The number one health concern for nearly all of us is no doubt COVID-19. Unfortunately, that very real threat has also led people to neglect other aspects of their health. Heart attacks are on the rise, as well as non-COVID related deaths. So for some real advice we can all follow, we turn to the Central Ohio primary care physicians.
And joining me today, we have Dr. Bill Wulf, who is the CEO of Central Ohio Primary Care Physicians. And it's good to see you again, Doctor.
Thank you, Robin. It's nice to be with you.
You know, these past several months, I don't know if the word trying is enough, but it has been a very trying time for the medical community. Now you're finding patients kind of holding back from seeking medical attention for things not even related to the pandemic. Why is that?
You know, Robin, I think the elderly are appropriately fearful of being out. Whether it's in the grocery store, whether it's at church, and surely at the physician's office where they might be seeing COVID positive patients or interacting with them. So we've actually reached out to our patients to assure them that we're going through all of the correct processes to make their visits safe. We don't want a patient with diabetes or hypertension or a condition where they need an in-person visit to delay that visit.
And so you actually started this new campaign because you don't want this trend to kind of reach this crisis point, so to speak. So tell us about the We Are Here For You campaign.
Yeah, so we reached out to, we have found that communicating with our patients during this crisis, and especially those over 60 years old, is very, very important. And we've communicated with them on a regular basis, initially to say, don't come out. We don't want to see you unless it's an emergency. But now it's telling them that we do need to see you for certain conditions. We need to see you in person, and we are here for you, and we want you to be in our office for certain conditions.
In these unprecedented times,
we unite.
We commit
to make this our finest hour.
We are here for you.
There has been a concern about a secondary health crisis after all this because of the delay, because of these fears. What are you seeing on your end, and what would you say to people out there about that?
Yeah, so I would say so far we're not seeing that. We're not seeing conditions that have deteriorated from lack of visits. And I think much of that across the country is because of the development of telehealth, because we have used video, we've used care coordinators, we've used those processes that I discussed previous to seeing patients. We've used those to take care of people without seeing them. So I think we've not seen those secondary conditions developing.
So you talk about the telehealth visits. That's just one way that you've kind of transformed how you do what you do. A couple other ways that you've done it right. You have after-hours visits. I mean, you've kind of expanded the way you're reaching your patients.
Yes. So prior to this, we had opened an after-hours support center. When we have reached out to our patients in the past, and during a study over a year ago, we asked patients, had they called their physician prior to going to the emergency room? And only 20% had. The other 80%, we asked them why they didn't call their primary care physician before heading to the emergency room. And the number one response was they did not want to bother their doctor, especially after hours. And so we opened an after-hours support center. Supported and primarily supported by Agilon Health, our joint venture for taking Medicare Advantage risk. And it was oftentimes the elderly who didn't want to bother their doctor. So we now have an after-hours support center. So no longer do you get a voicemail telling you, these are the things I can't do for you after hours. Leave a message, I'll call you back. We have nurses answering the phone until 11:30 at night. Since March 16th, we have done over 900 after-hours video visits. Half of those visits were actually deemed urgent, meaning the patient needed to be seen within 4 hours. So we set up COPC now, which is somewhat like an Uber system where our nurses place a patient into a queue, key them up for a visit, and then a doctor picks them up. And we found that physicians after hours are picking up patients within 1 minute of them being placed in a queue.
And you obviously do a lot of outreach now, too, even to your high-risk patients. And it really just shows kind of your investment, your physician's investment, right, in not just the disease or the illness, but the person. And I'm sure easing people's fears has been a big part as well of what you've had to do lately, right?
Correct. And we did reach out to over 4,000 patients that we felt were high risk based on their conditions, based on their previous ER utilization, and based on living alone. So we identified through our electronic record those over 4,000 patients we felt were high risk. We reached out to them with a care coordinator who actually did a video visit to see, did they have medical needs, did they have social needs, whether it was picking up prescriptions, whether it was getting food. We were able to help them during a time when we actually had told them to stay home.
You've also got a great website you have created, resources for people should they have any questions. It's wearehereforyou.us. So we encourage people to go there, find out more information. Dr. Wulf, always great to chat with you.
Thank you, Robin. I appreciate the time.